Good evening, I'm Ian Hannamansing. Tonight, families mourn loved ones who lived or worked in long-term care homes.
He was the one. He was the one.
Plus, waiting for information about a family member 8 days after they died.
What we're seeing now here is everyone rushing.
Words of caution about possible COVID-19 treatments.
The virus can find vulnerable places.
Lessons for Canada about when and how to reopen or not. And tensions in a town worried about community spread.
I told him just stay home, said I want to help.
Why what happens there matters across the country. This is The National. As another week comes to a close and many Canadians are growing restless, today brought a message of cautious hope.
We're not at the point where we can let off those restrictions yet, but there is some room in the future for us to say, what does it look like to maintain distance but have more social contact?
The trends in BC are promising enough to let people here imagine at least a step back towards normal. But the overriding message is to maintain vigilance, so the sacrifices already made will continue to make a difference. Tonight, we'll learn from other countries what can happen when things are rushed. But first, a sobering dispatch from the front lines. Long-term care homes. Ellen Morrow looks at the price being paid in lives.
A parade of support outside a care home mourning one of its own. Christine Mandagarian, a personal support worker for 31 years, died this week of COVID-19.
I can't really digest anything right now. I can't even imagine that she's gone.
Mandagarian's family did not get to say goodbye. Hospital lockdowns barred them from visiting.
In a cold room, she died all by herself, all alone, with kids not next to her, husband not next to her, nobody next to her.
Across Ontario, more than 200 long-term care residents have died, and about half of Canada's COVID-19 deaths overall have been linked to long-term care centres.
A few weeks ago, these poor residents were smiling at us, and it's so hard to lose them all so fast.
Rebecca Pirinen is a personal support worker at a home where at least 19 residents have died. We filmed her getting tested for COVID-19 last week. Her result was negative, but hundreds of care workers have fallen ill. Every day, she says, they work in grief and fear.
We are the most vulnerable, but we are the closest connection to them outside their family.
Oh, sorry.
For those family members, the loss is unbearable. Debbie Gregan's father, Charles Lupton, died 2 days ago.
He would welcome you with open arms no matter where you came from or what you did or how many times you did it. And he was just a great guy.
As with so many families, Lupton's loved ones weren't allowed to be with him at the end. With physical distancing, they now mourn the central figure of their family alone.
He was the one. He was the one.
And now they're forced to live without him. Ellen Morrow, CBC News, Toronto.
As Quebec grapples with its own crisis at care homes, today the Prime Minister said help is coming from 125 members of the armed forces who have medical training.
We were asking since few days how many do they have, and we didn't get the answer until this morning.
The teams will include nursing officers, medical technicians, and support personnel, and their deployment begins tomorrow. The Prime Minister called this an unprecedented move, pointing out the Army is usually called in for emergencies like floods or forest fires. One Quebec family has been living with an urgent and unsettling situation for more than a week. Their mother died in a long-term care home. 8 days later, they were still scrambling to find out where her body was. Sarah Levitt shows us what they've been through.
Where's our mom? Where's our mother?
Sleepless nights and endless worry. That's how Wendy Paquette describes the last 8 days. This is how Paquette remembers her mother. Bringing spirited enthusiasm to her seniors' home even at age 84. Barbara Paquette died on April 9th. But for 8 days, the family had no word of where her body was.
Is she in a truck? Is she at a crematorium? Is she we have no information. And yes, it makes us angry, frustrated. It's nightmarish.
More than half of the residents inside this long-term care home located inside the LaSalle Hospital have tested positive for the coronavirus. 66 in all. 15 have died. The health authority says a refrigerated truck has been set up outside, ready if the morgue fills up. They would not say if it is currently in use. As for the normal procedure when it comes to a death, the admissions department contacts the family and/or the funeral home to pick up the body for transport to the appropriate funeral home.
What we have stressed from the beginning is the importance of communication with the families, and especially to know where their loved ones are. So we will look into that.
We don't have a death certificate. We don't have remains.
Tonight, the family got word their mother's body was transferred to this funeral home sometime today. The news brings relief and with it the chance, at last, for a final goodbye. Sarah Levitt, CBC News, Montreal.
In Alberta tonight, the town of High River is scrambling to contain the virus while doing their part to keep Canadians fed. More than 350 people connected to a major beef processing plant have tested positive. Erin Collins looks at the tensions in a community worried about community spread.
COVID-19 means a very different kind of outreach for Pastor John Batista these days, delivering essentials to members of his congregation struggling with the virus.
It's also pretty scary for me because I have my son, he's asthmatic. And I told him just stay home, said I want to help.
The entire family that lives here has tested positive for COVID-19.
We have still a little bit coughing.
Bren Alindo and his mother both work at the local Cargill beef processing plant.
You think it should be closed?
Yes, of course. Because there's a lot of people that working there, and then when they got home about a week, and then they start to experience the cough, fever.
50 workers at the Cargill facility have now tested positive or are believed to have COVID-19. The company's slowed processing but has yet to close its doors.
This plant processes more than a third of Canada's beef, so there is pressure to keep the doors open. But experts say that if it were to close for a couple of weeks, it likely wouldn't impact the amount of beef in Canada's supermarkets.
High River's mayor sends out a weekly video update. This week he did more than show off a new look. He defended Cargill's handling of the outbreak.
Number one, this is not a Cargill virus. This is not the time to be blaming Cargill for anything.
And Alberta's medical officer of health says the COVID outbreak in High River isn't limited to Cargill.
But many of those cases were linked to large households where there are many people living together in the same house. And many of the other members of those households are working in healthcare.
The Alindo home is proof of that. Bren's father, now in a Calgary hospital with the virus, works at a local health center in High River. And Alindo, now thankfully on the mend, has a message for all Canadians.
God bless and stay home.
Good advice for all that some still have the luxury to heed. Erin Collins, CBC News, High River, Alberta.
And as we learn of fresh outbreaks in workplaces and long-term care facilities, Canada has nearly 32,000 confirmed cases, and the so-called curve is cause for caution. The number of new confirmed cases today, at least 1,820. That's a new record for Canada, breaking the previous high from yesterday. But where you live makes a big difference.
You know, we are a bit of an oasis here right now, and we're blessed by that, and we do not want to lose traction in that regard.
New Brunswick and Manitoba, for instance, posted no new cases today. Infections here started later, and there was a quick crackdown on the virus. Ontario, Quebec, and British Columbia were first hit by the virus way back in January. But today, British Columbia reported just 43 new cases. Its outbreak has been charting a very different path. And that fact was clear in the presentation from BC's top health official today. But as Greg Rasmussen explains, she's calling for vigilance, not declaring victory.
The tough measures that have turned the streets of Vancouver into a ghost town are saving lives, and people need to keep it up, says BC's provincial health officer.
to stay close to home, to stay close to our families, to keep those safe distances.
BC feared a surge in cases similar to what's happened in Quebec and to a lesser degree Ontario. Instead, the province's infection rate is much lower, so much that there's talk of a cautious reopening, but not quite yet.
We need to find the balance of, how much contact still protects us in our communities and our families, but allows us to open things up. So I can't tell you exactly what it looks like.
Planning is underway on exactly how, when, and where schools and businesses will reopen. One key will be to have testing and other measures to quickly respond to and contain new cases.
And all of a sudden, my breathing started to get really restricted.
From someone who's had the disease and is still recovering more than a month later, a warning about risky behavior.
We really have to get this under control. Like, I haven't been able to sleep properly. You're uncomfortable in your own body all the time. It's just not worth it. Like, just stay home.
Also from BC, new data on who is being hit. The median age of people contracting the disease is 54. For those requiring hospitalization, it jumps to 68. And the people dying are much older, with a median age of 86. Officials here stress that despite BC faring better than much of the country, it's still a long and difficult road ahead. Greg Rasmussen, CBC News, Vancouver.
That demographic data on age and sex of COVID-19 patients can be important in understanding the spread of the disease. But as Chris Glover tells us, there is data we aren't tracking, and some say that reveals a dangerous blind spot.
In a pandemic, it's critical to know exactly who's getting sick.
So you have to collect the data to do good medicine.
Dr. Quam McKenzie says Canada's practicing bad medicine by not collecting the race of COVID-19 patients.
Certain groups of people are systematically disadvantaged based on...
Alberta committed to looking into it, but Ontario says tracking age and chronic illness remains its focus.
So those are all priorities to us, regardless of race, ethnic, or other backgrounds. They're all equally important to us.
A coalition of Black health leaders is demanding officials reconsider.
Hearing this remark is concerning because it doesn't allow us to fully understand the impacts of COVID.
In Chicago, Black people represent 30% of residents, but more than 70% of COVID deaths.
Those numbers take your breath away.
Its race data prompted officials to redeploy resources to predominantly Black neighborhoods that have long struggled with poor access to care and chronic illness.
COVID-19 is the perfect storm for our Black and Brown communities.
During the H1N1 pandemic, Indigenous people in Canada were 6.5 times more likely to end up in the ICU. Even without race data for COVID, Indigenous health leaders want more resources now.
Knowing that these communities are at higher risk for multiple reasons should be a call for action.
We can actually guess or we can know, and I think we should know.
Dr. McKenzie says better tracking means a better response and potentially a shorter shutdown of society. Chris Glover, CBC News, Toronto.
It has been almost 2 weeks since the federal government opened up the Canada Emergency Response Benefit, and already millions of people have received their money. More than 2 million applications were processed just this week, and over 7.5 million in all. Today, Ottawa announced new measures to help the country's energy sector. Salima Shivji explains the move and the politics.
It was promised.
I'm not talking about weeks, I'm talking about hours, potentially days.
Now, 3 weeks later, details on help for the oil and gas sector, hit by both the COVID-19 crisis and a crippling drop in the price of oil.
Our goal is to create immediate jobs.
$1.7 billion to save jobs devoted to cleaning up orphan wells, abandoned by oil companies, inactive and festering.
We think that it could employ upwards of 5,000 people. We'll be able to get them working right away.
Another $750 million in loans to help smaller oil companies cut methane emissions, and a promise of more credit to come. The Liberal government's still trying to walk a political line, balancing existing concerns about energy and climate with the urgency brought by COVID-19.
Just because we're in a health crisis doesn't mean we can neglect the environmental crisis.
It's miles away from the billions of dollars in bailout money for the auto sector after the 2008 financial crisis, and yet a win on many fronts. From a frequent foe, a thank you, but
more needs to be done. While this was a very important step forward,
and the federal Conservatives also approve, even as they say this should have been announced earlier.
We've long supported the idea of providing assistance to clean up orphaned oil wells.
In more normal times, this move would have garnered more questions. Why taxpayers are footing the bill for what oil companies left behind. But in a sign of these times, many environmentalists too are calling this a smart move. Salima Shivji, CBC News, Ottawa.
We're following several other stories across the country today, including a dramatic change if you're getting on a plane in this country. Transport Canada says all air passengers leaving or arriving at Canadian airports will now have to wear a face mask or risk being denied boarding. Starting Monday, non-surgical masks will also have to be worn at all airport screening checkpoints. BC Premier John Horgan says he won't necessarily follow Ottawa's lead on when to reopen the U.S. border. Horgan says his goal is to coordinate directly with the governor of Washington state, stressing that regional planning is more important than federal direction. The Prime Minister has said it's still too early to talk about opening the border, but admitted some provinces may be ready to do so before others.
I know that we have to bridge the gap for those kids that may not have the tools to learn.
Ontario has teamed up with Apple and Rogers to help students from low-income families learn at home. They'll receive iPads and tablets with free wireless data plans. And this Manitoba school is using a drive-up Wi-Fi program to help rural families with limited internet access. It lets students download what they need to work offline. China revised its numbers today on COVID-related deaths, adding more than 1,000 in the hard-hit city of Wuhan. That's raising questions about transparency. But as Sasha Petrusik tells us, the government says it's not hiding anything.
As mourners file through Wuhan's funeral homes to pick up the ashes of loved ones, urns are piled by the thousands. I grieve for China's big calamity, he says. But now Beijing concedes it was even bigger than first announced. COVID deaths in Wuhan higher by some 1,300. Reports were simply delayed or missed, he says, denying any cover-up. That accusation has come from American President Donald Trump all week as he tries to divert attention from high numbers at home.
Do you really believe those numbers in this vast country called China, and that they have a certain number of cases and a certain number of deaths? Does anybody really believe that?
Trump condemns China for its initial response, delays that allowed the virus to spread, say U.S. officials. The first doctors to sound the alarm in Wuhan were silenced by police in early January, 3 weeks before the city was locked down. A study by Southampton University says if that had happened a week earlier, 65% of infections could have been avoided. 3 weeks earlier would have meant 95% fewer cases. Former Canadian Justice Minister Irwin Cotler blames the West's indifference to human rights abuses by China's leaders.
What then happens is that they feel emboldened to go ahead and engage in something like suppressing information regarding what then became a global pandemic.
China says the rest of the world should be thankful because its efforts gave other countries time to prepare, and the World Health Organization backs China's new numbers. Instead, though, anger seems to be growing as both Britain and France now insist China has much to answer for. Sasha Petrusik, CBC News, Tokyo.
You heard there how the U.S. president is casting blame on China. Some feel he's also striking a discordant tone at home. After leaving it to governors to decide how and when their states relax stay-at-home orders, Donald Trump then tweeted support for protests in Michigan, Minnesota, and Virginia, which called for an immediate return to normal, and in Michigan's case included a call to remove the governor. In Florida, some beaches reopened today, though officials emphasized people should enjoy them by staying 6 feet apart. So while parts of the U.S. start to reopen, the opposite is happening in Singapore and Japan. Those places had earlier outbreaks under control. Thomas Dagla looks at the lessons to be learned from the second wave.
In this battle, there's hardly a secret weapon. Even in Singapore, once considered a model in the fight against COVID-19, it's come down to disinfecting and cleaning, especially in dorms for migrant workers. Where they eat and sleep, it lives and spreads.
What it says about the virus is that the virus can find vulnerable places. It's kind of smart.
With outbreaks in dorms, Singapore is now seeing infections by the hundreds. The outbreak spilling into the general population as well. It seemed an unlikely development in an island nation that aggressively tested and tracked its few early cases, even using a smartphone app for contact tracing. And yet,
we don't know how they got infected or from whom.
There's confusion too in Japan, where they're setting up makeshift isolation spots at the airport. The country only now under a national state of emergency, as Tokyo sees its biggest daily case count yet, and government briefings warn of hundreds of thousands of deaths if nothing is done. With holidays ahead, Prime Minister Shinzo Abe is urging people to avoid travel so the virus doesn't spread from one region to another. Japan's strategy of targeted testing seems to have only shown part of the picture, and this public health expert fears the worst is ahead.
We will see a potential surge of the transmission, particularly in big cities, and my biggest concern is the collapse of the healthcare system.
Yeah, how concerned are you about that?
Very concerned.
In some places, the second wave appears worse than the first. For those who've recovered, though, the risk of reinfection seems minimal. The war wages until a vaccine is found. Thomas Dagla, CBC News, Toronto.
Well, let's bring in Dr. Isaac Bogosh, an infectious disease specialist who actually spent time in Singapore in the early days of this crisis. And Dr. Bogosh, what's your reaction to seeing this second wave in Singapore?
It's really interesting to see this in Singapore and even in other places that have experienced the epidemic before Canada, like South Korea, Japan, and Hong Kong. They're all experiencing second waves. And, it really doesn't come to anyone's surprise when people start to mingle again. There's just the opportunity for this virus to be transmitted in community. So we have to be very, very careful that when we do the same in Canada and we sort of start to release these public health measures, we are aware that there is going to be a second wave, and we have to do everything we can to mitigate how big that second wave is.
And what about some specific lessons here?
Yeah, really specifically, we have to make sure that during the time that we are lifting these restrictions, we have tremendous access to diagnostic testing. We have to have a really strong capacity of our public health system to do contact tracing, to really make sure that all positive cases and their close contacts can be placed in a 14-day period of isolation and support people while they're in that 14-day period of isolation. And of course, we need to make sure that our vulnerable populations, most notably those in long-term care facilities, are protected throughout that process.
All right, Dr. Bogosh, we'll talk to you again later in the hour. Thanks.
Take care.
One of the world's biggest concert companies is facing steep criticism for holding on to ticket money.
I mean, they're worth billions of dollars. I don't understand why they can't offer refunds.
Up next, what Live Nation says they'll give back and what they'll hold on to. And the rush to research.
TikTok, let's get going on this.
A few drugs are getting a lot of hype. How to make sense of early results in the search for a COVID cure. And looking for love in the time of coronavirus.
The question is, will they ever get together in the real world?
How the order to stay in is changing the face of dating. We're back in 2. This is what a live concert looks like these days. Artists performing from their homes to yours. And tomorrow night, a global virtual concert.
Till the coronavirus declines, I'll stay home with you.
The WHO is partnering with the group Global Citizen and Lady Gaga to broadcast One World Together at Home, a benefit concert in support of the fight against COVID-19. The 2-hour special will air at 8 p.m. Eastern online and on TV channels around the world, including CBC Television. But if you were hoping to get a refund for a postponed live show, good luck. As Dave Seglins explains, Ticketmaster is holding on to your cash.
The thrill of live music. This is how we used to roll until a month ago. COVID-19 has shut it all down around the globe. Fans now stuck with tens of millions of tickets for shows either canceled or postponed.
We bought tickets for Justin Bieber as well in September.
Dylan Snow is stuck with $4,000 worth for 2 shows that he bought for friends. He's considering legal action as Ticketmaster and its parent company Live Nation won't give him his money back.
They postponed the concerts with no known performance date. I mean, they're worth billions of dollars. I don't understand why they can't offer refunds.
Live Nation is asking fans for patience. It's only giving refunds to shows that are canceled outright. But 90% of all shows are technically just postponed.
You have many people.
This U.S. senator believes the company has no right to hold on to fan money.
I've asked the Attorney General to look at whether this rises to criminality, or if not, at least to civil penalties. But make no mistake, this is just fundamentally wrong, and to do this during a pandemic.
In Canada, there are calls for an investigation too, especially given Ticketmaster's history over the resale of its own tickets.
Ticketmaster needs to refund people, in my opinion, needs a further investigation because they have a virtual monopoly with regards to the type of services they provide. And treating them with kid gloves like we did last time with the scalping scandal certainly hasn't helped. We need to drop the gloves this time to protect consumers.
Tonight, Live Nation has announced it is scrambling to reschedule some dates and will offer refund if those don't work for ticket holders. But most shows remain in limbo, postponed, with Live Nation holding the money. Dave Seglin, CBC News, Toronto.
Our regular questions segment is next. Our experts tackling your issues, including, given the 14-day incubation period and the fact we've been in virtual lockdown for 3 to 4 weeks, where are all the new cases coming from? Plus, research rush making sense of a much-hyped drug treatment for COVID-19. Welcome back. Time now for your COVID-19 questions. With us tonight, 2 infectious disease specialists. Dr. Susie Hoda is back on the program after a bit of a break, and Dr. Isaac Bogosh back after maybe 15 minutes since we last spoke to you. And Dr. Bogosh, our first question to you. Given the 14-day incubation period and the fact we've been in virtual lockdown for 3 to 4 weeks, where are all the new cases coming from?
Yeah, the new cases are really coming from community settings. We know that there's not a lot of travel going on right now, so we're not having many imported cases from outside of Canada. And these are still from people who are acquiring the infection in the community. There's also a disproportionate number of infections in long-term care facilities. We've heard of some very high-profile outbreaks in these settings, and that's certainly accounting for a lot of the new cases and sadly a lot of the new deaths as well.
Dr. Hoda, we're getting a lot of concern, a lot of questions about asymptomatic, pre-symptomatic people. So here is the specific question I want to ask you. Is there solid evidence that a person can be highly contagious before displaying outward signs of having COVID?
There is some evidence of that, and it comes from epidemiologic studies where they've looked at clusters of infections and tried to determine how the transmission occurred. And there have been cases where people who are not yet symptomatic but will develop symptoms, or who are asymptomatic, have transmitted on to their close contacts primarily. But also, if you look at some other experimental studies at viral shedding, it's shown that you can shed a fair amount of virus, as much as you would in the first couple of days of your symptoms, in the 2 to 3 days that precede the development of symptoms in some people.
All right, a big concern for a lot of people, as I mentioned. Dr. Bogosh, next question to you. When might I be able to visit my older parents without the risk of infecting them?
That's a very challenging question because we're still in the pre-vaccine era and we have to do everything we can to protect those who are more vulnerable. And certainly we know that people over the age of 60 have a much higher risk of having a more severe infection than younger individuals. And really, of course, we have to stay in social contact with our family and our loved ones, but we really have to make sure that we are, not in any physical contact with those individuals. So I think it's too soon to do this. And I would do everything possible to keep one's distance from elderly people, especially parents. In the same breath, of course, we know some people live in some circumstances where they have to go into the home. People might need help or support, and those are challenging situations. So if you absolutely have to go into the house to help out, just make sure that you don't do so if you have any symptoms, and really be mindful of hand hygiene prior to going in.
Yeah, it sure is a tough dilemma. Last question to you, Dr. Hoda. We have about 45 seconds, and Dr. Bogosh talked about vaccines, and so we get to this. Why does it seem like doctors are more interested in vaccines than treatments like antivirals?
Well, there are some clinical trials going on for antivirals and therapeutics, so I wanted to say that. But the difference is that vaccines are targeting prevention. And, if we can get a good vaccine out there, we can potentially abort this pandemic by vaccinating all the people who haven't yet been exposed or infected and preventing them from getting infected. That's really what the goal is with vaccines.
It is so nice having two infectious disease doctors just at my beck and call here. Just ask you anything I want. Thank you very much. And we'll continue to ask questions about COVID-19 every night here on The National. And you can send us your questions both by Instagram and also on email. Our email is at covid@cbc.ca. Just put The National in the subject line. Of course, they're not really at my beck and call. In any event, whether it's a vaccine or a drug treatment, the pressure is on medical scientists to work quickly. One drug designed to treat Ebola is showing promise for COVID-19. But as Vicodopia tells us, some say the risk in rushing for a cure is too high.
Remdesivir had some treatment success during the most recent Ebola outbreak. The maker Gilead is now using it on patients with COVID-19 in a clinical trial. Leaked partial results show that of 113 severely ill patients treated with the drug, most recovered and were sent home in a week. 2 died. The data has not been peer-reviewed or published. Still promising, but from a research perspective, problematic.
Without a control group, it's really, really difficult to tell whether you're just picking the right patients who are doing better, whether this is exactly what would have happened to them anyway. So it's good that these data are getting out there, but I think it's really premature.
This doctor keeps tabs on the quality of scientific studies, like this French physician's influential work on using the drug hydroxychloroquine for COVID-19, which has since been questioned by the journal it was published in.
What we're seeing is sort of a ramping up of a lot of trends we've already seen. Published word parish has been real for many, many years, many decades. And so what we're seeing now here is everyone rushing to publish, journals rushing to publish.
Some research is posted online as a preprint before it's even verified by journals. This health policy researcher says the pressure for academics and scientists to show results right now is unprecedented.
TikTok, let's get going on this. And you want to get it out, and I've already started thinking about, should we put this out in a preprint? We want to make this available, but at the same time, you want it to be peer-reviewed, you want it to be high quality, and you want it to have enduring relevance.
Researchers have registered more than 600 COVID-19 related clinical trials for everything from existing drugs like hydroxychloroquine and remdesivir to vitamin C, even potato starch. None of them are approved for standard treatment for COVID-19, and it's likely few ever will be. Vicodopia, CBC News, Toronto.
Next on The National, deep concern on Canada's farms. Why COVID-19 could cause a price hike at grocery stores across the country. But first, the virus has made us reconsider how we do small everyday tasks, and we've been breaking them down in our daily COVID-19 how-to guide. Today, should you disinfect your jacket when you come home?
Your jacket protects you from the elements, but is it a liability when it comes to the coronavirus?
Hard surfaces are what the coronavirus likes more, and remember, hours to days is how long it can last, so it could technically last on your jacket.
So what you decide to do will depend on a few things. For one, how much of your time you want to spend disinfecting things. If you're in contact with a lot of people in the outside world, then yeah, maybe your risk is higher. But here's what any epidemiologist will tell you. It is your hands, much more likely than your jacket, that will get you sick, so wash these. But for all the parts of you that are in contact with the outside world, if you have reason to think that your jacket may be contaminated.
Within reason, this is where we want to up our cleaning and making sure that if we do think that someone sneezed on our jacket or whatever, yeah, put it in the wash.
The cost of some of your groceries could soon be on the rise because of COVID-19. The food supply has been central to the story of this pandemic. Early on, some panicky shoppers cleared shelves to stock up, and simply going for groceries has become an exercise in patience. But now we're learning that measures to contain the virus have delayed the arrival of foreign farm workers. Kayla Hounsell spoke to farmers who warn of shortages and higher prices.
Charles Keddy is doing his best to get his strawberry plants in the ground, but there's not much activity in his fields these days. His employees, temporary foreign workers, are quarantined in their bunkhouses and can't work for 2 weeks.
Yes, this is how we do it.
Already delayed, they've just arrived in Nova Scotia from Jamaica. For most, not coming wasn't an option.
We have to do what we have to do, and this is work, and without work we will not survive.
Their boss says crops, too, may not survive without their help to plant and harvest them.
If the rest of the workers don't get here in a real timely fashion, it could have quite an effect on the local food supply.
This food security expert says Canada's agricultural sector is dependent on foreign workers. 60,000 came last year.
So I think it's going to send a whole bunch of disruptions, and the fact that we aren't able to get labor in this sort of a seamless or frictionless way as we're used to means that planting will be delayed, that things like pruning apple orchards won't happen with the same level of efficiency.
It's all under the ground, just itching to get out. So.
This Ontario farmer says his asparagus crop will be ready for harvest in 2 weeks. He still doesn't know when the bulk of his workers will arrive. And even when they do, they'll have to be quarantined, potentially further delaying harvest.
Rather than having 3 beds, we'll only be able to have 2 in here.
He is renovating accommodations, retrofitting machinery, and he has to pay employees while they're not working. The federal government has announced $50 million to help with the costs of isolations, but physical distancing will also mean lost money.
We're going to, instead of having 18 or 20 people on that line, we'll probably have to have just 10. So, we just have to run it slower, and so it's going to take longer to process things.
Lower efficiency and higher costs for farmers could end up costing consumers more too.
I think just about everything is increasing the cost of the product.
Experts say shoppers could see an increase of up to 15% on some foods, but so much depends on the continued arrival of foreign workers.
We take it seriously, and as Jamaicans, and we will continue to do so.
Still, when the crisis has passed, farmers and experts agree there should be an examination of the vulnerability of the Canadian food supply chain. Kayla Hounsell, CBC News, Halifax.
We've been taking time on the program each night to let some of you share how your world has changed over the last few weeks. In tonight's Pandemic Diary, meet Lynn, who's figuring out homeschooling for 5 of her 6 kids.
Hi, my name is Lynn, and I have 6 kids ranging from the ages of 6 to 20 years old. I worry about distance learning because I have 5 kids here at home that I have to help study and do homework with daily. Our kids share laptops, and we were lucky enough to receive one from the school. Our 2 youngest boys have learning needs, and they need individual attention in order to complete their work successfully. My husband works from home, so he unfortunately cannot help me out during the day, and my 2 oldest kids help me out when they can. Another reason why I'm so worried is we have 2 family members that have compromised immune systems. One of them being my husband, who is our sole financial provider, and we have strict systems in place in order to keep us safe. If something was to happen to my husband, we would be in a big financial burden. What I hope for is that society will start to follow rules that our leaders and healthcare workers provide for us. We can work together in this fight against COVID-19 and flatten the curve.
And thanks to Lynn for sharing her family's story. Next on The National.
What we've seen actually is a pretty big increase in people who are open to virtual dating.
Figuring out how to go out with someone while staying in. It wasn't the day they'd been planning, but it was certainly a day they'll remember. John Karamaya and Kim Nguyen were supposed to get married at a Toronto restaurant. That was pre-COVID. But of course, everything has changed. The couple didn't want to cancel completely, so they said their I do's on the rooftop of their condo.
At the end of the day, we knew we want to marry each other. We love each other so much. And
despite setbacks, I think that you can make the best out of every situation.
They plan to throw a party sometime next year. Singles are having to adapt as well. Dating apps were already popular before the pandemic, but now, as Eli Glasner explains, interest is surging even more as people look for love in isolation.
Hey, here we go. How are you? Good, how are you?
Like so many of us, Raquel Russell is stuck at home. Pre-pandemic, she had a love-hate relationship with dating apps.
I would get frustrated with them and then delete them and then download them again and then delete them.
Then the coronavirus arrived, so she went back on the apps and discovered the tenor of conversation had changed.
It's been nice to find folks that are willing to talk for several days and talk about all kinds of things.
This relationship expert isn't surprised.
People are reaching out as a way to abate some of their feelings of anxiety and depression. The question is, will they ever get together in the real world?
That's the question for this hairdresser. He's keeping busy by sharpening his skills, but he'd rather be seeing the woman he met just before the stay-at-home order was put in place. Instead, he's channeling his frustrations into FaceTime.
Yeah, it's not the best, I'll tell you that much, to not being able to personally, physically see someone.
And he's been tempted to go further.
So I'm not gonna lie, like there's been a couple scenarios where we've been, on the FaceTime and we've tried to, sort something out, but at the end of the day, we still gotta abide by the rules,
Those rules are leading to a surge in traffic on dating apps.
What we've seen actually is a pretty big increase in people who are open to virtual dating. We've seen a 56% increase in the usage of our in-app video calling, which is pretty incredible. And the call time now is actually at 29 minutes on average.
This single mom is one of many now considering video dates.
You share a recipe and you can cook the same dinner and eat the same dinner, or you can just share a glass of wine and have drinks, or you can schedule to watch the same movie and press play at the same time.
A new, safer way of meeting someone that could outlast the virus. Eli Glasner, CBC News, Toronto.
Next on The National, our moment.
Juice, sauce, little bit of dressing.
That is Dame Judi Dench rocking a TikTok dance with her grandson. She's not alone in trying new tech in the time of COVID.
Turn down the TV. I think my grandma's calling me.
Next, while the pandemic might have created a new generation gap, grandparents and grandkids are finding new ways to connect. But first, this weekend, CBC News and The National bring you two special programs. Andrew will have information you need to navigate the pandemic on coping with COVID, stories of hope, helpers, and mental health. That'll be on CBC News Network tomorrow at 5:30 p.m. Eastern. And a little later, Adrian has stories of healthcare workers leading the fight against COVID-19. CBC News presents From the Front Lines. That's at 7:30 p.m. Eastern. And of course, you can get both programs anytime on CBC Gem. As we're following the rules to stay apart, technology is helping us stay together. You may have experienced your own family Zoom call recently, or maybe you've been FaceTiming with friends. There's a lot of time for people to take some chances with new tech, and that's at the heart of tonight's moment. TikTok isn't just for Gen Z anymore. It's just one of the ways grandparents are connecting with their loved ones during COVID-19. Oh, and that is Judi Dench, by the way. Meanwhile, others are putting their landlines aside and learning how to video chat for the first time.
Love you.
The framing isn't always perfect, but the conversations often are. Just ask 109-year-old Jemima Westcott and her granddaughter, Renora.
She saw the little video button and tested it out, and we were good to go. So I had such a surprised look on my face because I'm like, I can't believe that's really happening. She's been through 2 pandemics now. She was only between 6 and 7 during the first one. We're so lucky to actually have a person that we can talk to that has memories from over a century ago.
Now a chance to create new memories together and proof you're never too old to learn something new. And think about stretching back and having actual memories of the Spanish influenza, and in turn, Renora may be telling stories about what happened right now in the year 2100. Just think that's kind of scary even to think about for a moment. Anyway, you have all weekend to mull that over. That is The National for Friday, April the 17th. Good night.